We're going to be showing you a UroLift procedure today, and we'll briefly talk to the patient afterwards to get his experience. Here's the procedure room. At the beginning of the procedure, we perform a transrectal ultrasound-guided prostate block to adequately numb the nerves that innervate the prostate and the surrounding area and make the patient much more comfortable during the procedure. We additionally instill some cold lidocaine and lidocaine jelly transurethral into the bladder and the prostatic fossa to help with the cystoscopy portion of the case. Here we are entering the patient's urethra with the cystoscope designed for UroLift placement. As you can see, the patient is tolerating it very well. Here's the cystoscopic view. As you see, we have excellent visualization as we get into the prostate here and finally into the bladder. Once we do this, we change out our inner sheath of the scope for the UroLift instrument in anticipation of placement of the first UroLift device. The UroLift device is then placed through the sheath back into the bladder. We then rotate the device and move back into the prostatic fossa to find its ideal location. Here you see us firing the device and tensioning the suture. Once we find the correct location, we release it and go back into the bladder and exchange for another instrument. Here you see the same part on the other side from the outside. As you can also see, the patient is very relaxed through all of this and has minimal pain. The procedure is eventually repeated 2 more times for a total of 4 UroLift devices, 2 at the base and 2 at the apex. As you can see here, after placing the left-sided device, a little bit of bleeding is noted, but a good open channel is seen. After the placement of the last device, we then go back into the prostatic fossa to ensure a excellent anterior channel is created. As you see here, the bladder neck is preserved for ejaculatory function, and yet there's a wide open anterior channel. This concludes the UroLift procedure. This patient tolerated it well and was left without a catheter. Hi, this is Dr. Sundaram. You just saw Mr. Muller's UroLift procedure, and we're just going to ask him a few questions about how it went. What did you think about it?
Real easy.
Yeah? How was the pain?
I don't think any of it on 1 to 10. I don't think it was ever over about 3.
Okay, excellent.
Yeah.
And would you have the procedure again?
Oh, yeah.
Absolutely?
Yeah.
Great. That's wonderful to hear. Was there anything that was bothersome to you or troublesome?
No.
You think we explained everything well beforehand?
You did a great job, yeah.
Great. All right, well, again, this is Dr. Sundaram, and we'll be following up with Mr. Muller in his follow-up visits as well. And you'll see how he does it 2 weeks and 1 month. Dr. Sundaram here, back with Mr. Muller. He's 2 weeks post-op from his UroLift, and we're here to check in and see how he's doing.
Great.
Yeah?
No pain.
Excellent. And in terms of your symptoms, would you say
Way
they're
better.
Way better?
Way better, yeah.
Okay, excellent.
Yeah.
Yeah.
Yeah, there's no doubt about it.
And before the procedure, you were waking up pretty often to go to the bathroom, and now it's pretty rare.
Yeah, it's less than half.
Great.
Yeah.
Excellent. And so,
And sometimes not at all.
Awesome. That's
Yeah.
amazing.
Yeah.
And so if you had the choice, would you have the procedure again?
Oh, absolutely, yeah.
Excellent. All right.
Yeah.
Well, thank you so much for doing this. We appreciate it.
You're welcome.
Hi, it's Dr. Sundaram again, here with Mr. Muller. It's 6 weeks after his UroLift, and his post-void residual on his bladder scans is down to 3, which is basically 0, from about 30 preoperatively, and his symptom score is down from 18 to 13. And he's going to tell you a little bit about how he's doing.
I'm doing great.
Yeah?
Yeah.
Even better than you were at 2 weeks?
Oh boy, yeah, a lot better.
Great.
Yeah.
So the symptoms continue to get better, and what little pain you had from the procedure, is it gone, or is
Yeah, there's no pain.
nothing?
No pain at all now. It's all
Excellent.
gone.
Good. I'm glad to hear that. So, do you have any questions for me, or anything you want to say to the audience?
No, I don't think so, except I'd recommend this to anybody.
Excellent.
Yeah, it doesn't hurt. There's no pain in it, and by golly, it works.
Excellent.
Yeah.
I'm glad to hear that. If you have any other questions about your urologic care or would like more information on the procedure that you just viewed, please call the number below to schedule an appointment with me.